Today's topic is freezing and falls. Uh-oh. How many of you Parkinson patients have ever fallen down? Oh, hello. Falling down? Yeah, it's no fun, is it? It's no fun. It's not a good thing for you to be doing. It's a big problem with Parkinson's disease. All right, why do you think you fall, my friends? Balance. What happens to your balance? Goes kaput. Right? Yeah, because you're dealing with weakness in your muscles, you're dealing with stiffness, you're dealing with rigidity. And this not only is the Parkinson's disease, but many times sensational seniors like us, okay, also are affected by arthritis, right? How many of you have arthritis, where the joints get a little bit stiffer? So a certain amount of loss of balance during the aging process, is normal. But with Parkinson's disease, it makes it very, very difficult because you have weakness and rigidity in your muscles. All right, so what do we do about that? Exercise, exercise, exercise. This is one disease that if you want to do well, if you want to stay active, if you want to stay engaged in life, and that's the name of the game, isn't it? Yes. I don't want you sitting home with the clicker. My friend. Sorry, I meant to silence that. I don't want you sitting home with the clicker and the recliner all by yourself. It's me now. All right? Where do I want you? I want you here. I want you in the community. I want you doing the things that you love to do. It's critical. All right? Because one of the greatest ways to maintain quality of life is to maintain the ability to do what you love to do with the people that you love to do them with. All right? So that takes an effort on your part, because with Parkinson's disease, it's a lot easier to stay in the recliner with the clicker. And guess what? It's a lot safer. Am I right? I know where you are. I know you're not going to fall and go bump if I've got you, strapped in the recliner, or if you're laying in the bed. But the key is to get up and about safely. All right? Now, with Parkinson's disease, it's chronic, progressive. That means what? It's creeping up on us, it's keep moving forward. So it's critical for you to stay as strong and empowered today as possible. You can't sit back because it'll run you over. You agree with me? Yes. So that everything that you do here at Parkinson Place, from your voice to your exercise, to your dance, to your empowerment, to your engagement, sociability, you're treading water, you're staying ahead of it. So if you can say to me, Myra, I'm doing pretty good. I'm the same today as I was last week. Are you gaining on it? Yes, you are. Yes, you are. So if you tell me you're holding it status quo, I'm not going to worry about it. And it tells me that you're doing your absolute best to stay up and mobile and active. All right? What's the problem with falling? Okay, we break bones and I can't get up. And that's one of the wisest, funniest dads. I've fallen and I can't get up. That woman with a screechy voice, and her daughter's in Chicago, and she's in Tampa. All right. Falls are really bad for you. Falls are the #1 killers for seniors. Above heart attack, stroke, cancer, everything else. Why are falls so dangerous for you?
Difficult recovery.
What happens to you when you fall? Couple things. You can hurt. You can fracture. You can break a arm, a pelvis, a hip. All right. And then where do you end up? You end up on the OR table, with anesthesia, which is the worst thing for my Parkinson friends. And then you're in the rehab bed, and then you're in recovery and everything else. And what happens then? Pneumonia, clots, infection, kaput. All right? This is why it's so dangerous. It's the complications from the fall. Because if you break something, they can't fix it without anesthesia and without a recovery time in bed. And that's what is so bad for the seniors. Okay? The other thing too huge is what happens if you hit your head? You get a concussion, what else? It's okay, sweetheart, you don't have to jump up, I do it all the time. You bleed to death? Oh, that's lovely. After the chocolate cake. Yeah. You know, if any of you fall and hit your head, you must go to the emergency room and you must have a film done of your head. Is that clear? Even if you say to me, Marilyn, I didn't break the skin, I'm not bleeding, I'm not black and blue, whatever. Because you can have what we call subdural, which is a little bit of a bleeding between the brain and the skull, all right? And you might not even show symptoms for 3 weeks, 2-3 weeks. Are you clear with me? So anybody that falls here, I mandate it right across the street for a film. If you fall at home, don't take the risk. I will share with you, I had a wonderful patient of mine. I adored him. He was high level. He was doing everything he was supposed to be doing. He came home from the neurologist, and instead of sitting down to take off his shoes, to change his shoes from his dress shoes to his casual shoes, he did one of those stand on one leg like the ostrich. You know, how we hopping around, you know, taking it off. And he stumbled and he hit his head on the bedside table. And he thought he was fine. 3 weeks later, we lost him. All right, subdural. So I don't want to scare you, but I want to scare you. I want to scare you to pay attention to avoid falling. And this is all about intervention and prevention. Because you know you're a high risk. So what are some of the solutions? Exercise, absolutely. Exercise, absolutely. If you're a member of Parkinson Place, I expect to see you no less than 3 times a week for exercise. Take your pick, how you want to put them together. But between Mary Massey, Ageless Grace, y'all love Miss Mary, Fun Fitness with Kathy Sims. I just love to watch all these classes from the back room because I see y'all trying so hard and having a good time at it at the same time. This is helping you more than you will ever know. And Dance with Lamus. Okay? Do I have any other exercise classes from the neck down? All right. Get on in here and do it. And my seniors as well, my senior caregivers. This is all good for you. The only class that is not appropriate for you maybe is, oh, and yoga is wonderful as well. That's every Monday morning. The only class that you caregivers, I'll let you beg off, is voice aerobics. All right, unless you want to gain the skills to yell a little louder. All right? You want to let it rip? Get on in there, okay? Okay. So take advantage of these. Exercise. What can you be doing at home with regards to exercise in the community? Walking.
Swimming.
Swimming is fine, as long as you're not in over your head.
Stationary bike.
Stationary bike absolutely is terrific. Now always realize, my friends, I would encourage you, if you're going to do anything more than walking, I want you to just double check with your doc. Because if you have cardiac issues or some blood pressure issues or whatever like that, I encourage people to really say, this is what I'm doing for my exercise plan. Does this sound good for you? All right, and get a little bit of a verbal clearance. All right. Stationary bikes are great. Be careful on the regular bikes. Why? Balance. Okay. Okay. So exercise is critical. The other thing too, friends, if your balance is really bad, and if you are falling a lot, I want you to be on an adaptive device to keep you safe. All right? And a lot of people say, I don't want to do a walker, or I don't want to do a wheelchair when I'm doing the mall or the restaurant, or it's a far way to walk. I want you to do it anyway, because the key is to get you up and out safely. Right? So if you need that wheelchair, if you need that walker, that's fine. Canes, my vote is still out with the canes, with Parkinson Power, because with Parkinson patients, because from where I'm looking at most of you, you're carrying it like a purse. You guys. Right? They're not going to stop you from falling. And unless you need depth perception, which the other thing too is a lot of times with Parkinson, hi sweetheart, a lot of times with Parkinson Power, Parkinson patients, you lose the depth perception. What do I mean by that? You're not quite sure where that floor is. All right, so when you take your steps, if you have any neuropathy, loss of feeling in your bottom of your feet, so that cane will help you maybe with that. It's not going to keep you safe, and it's not going to keep you from stumbling. All right, even though you think it looks cute, it's not doing you any good. So I would encourage you, if you are falling, then you say, you know, it's time. It's time for me to get on my walker. Toya taught you at the last conference. Where do you have to be in the walker?
Inside it.
A little louder, tell them.
Inside it.
Inside it. Inside it. Inside the cage. Not chasing it this way. Yeah, now it's on rollers and you're going this way, leaning forward. So if that walker is correctly fitting you, so don't just go buy it at Goodwill or borrow your brother's, all right? Have it fit. Toy will look at it for you. It has to be the right height and it has to be right for you, okay? If you need to have a companion wheelchair, which is usually what my Parkinson patients need, because sometimes the big wheelchairs you need the upper strength to push them. They're hard for you. So for mobility in the community, from here to the car or whatever, the smaller ones, you know, that your loved one can push you safely and not use up your energy. You with me? Your goal is, how do I get out and about and have a great time today and do it safely? It's a key word. All right, how many of you rely on a walker? Sometimes. Sometimes, Rick just said to me, sometimes. You know, you don't have to use it all the time. The other time, when do most falls happen? At home, lots of times at the nighttime. And the worst place that a fall can happen is where? In the bathroom. Because there is nothing soft in the bathroom. The top of the stairs. How many of you have stairs in your Florida home? Do you? Yeah. Isn't it nice to be on one level? Yeah, it's nice. And that's a safety feature as well. All right. The bathroom, very, 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 very dangerous for you. All right? Why?
Because it's hard.
Everything is hard. Everything is hard. The sink, the floor, you know, everything. So you want to utilize what? What do I want in your showers?
Grab bars.
What? Grab bars. Why? So you can have something to hold on to. Because what? I want you bathing yourself. I want you washing yourself. All right, so I want you what? I want you in a shower chair. How many of you have a shower chair? Well, the rest of you need to get one if you're over 65.
How many Marilyns have a shower chair?
I have one. You know what? I have this. You don't know. I sold my big house, and I have a smaller house now. It's got this. I call it like a vintage shower. It's really, really cool. You know what I'm saying, with the tiles? And it's got this little seat here in the corner that I don't use because when you sit on it, it's so cold. I'm like, ooh. I'm telling you all the details, aren't I, guys? All right. All right. But because the other thing, too, is when you bend over, my friends, to do your legs and your feet, what happens when you bend over? You can really lose your balance. And there's only one place to go, and that's on the tile. So the shower chairs are really nice for you, whether you're putting it in a tub or right in a walk-in shower, okay? Because you can sit. If you can get one of those gizmos that spray you, how many of you have that? They're real nice, aren't they? You know, spray all over, right? So that's the other thing. You want to sit to what? Conserve your energy. You want to sit for safety, okay? And that way, the other thing too is use one of those long handle brushes or loofahs or whatever, because instead of sponge, that's it, Stan, thanks. Sponge, loofah, scrub brush, no, brushy thing. Scrub brush, yeah. With a handle, long handle. So you can go like this so that you're not going down like this. The other thing too is be very careful. A lot of times, ladies, when you're shampooing your hair, I don't know about you, but you shampoo your hair under the sink, under the shower head. What happens when you close your eyes? You can lose your balance. You can lose your point of focus. So be careful with this as well. Take your shampoo sitting down, all right? And just be very, very, very careful. All right? So I want to see grab bars that you can grab. Just leave it there. I'm telling you, I'm going to do it 100 times. Just leave them there. So grab bars that you can have. I want to see a nice suction mat. Do you all have them?
Yep.
Okay, want that in there too?
What?
Suction mat. What do you call them? The rubber mats? So you're not slipping and sliding. Common sense. I also want to see grab bars around the bathroom. Okay, so these are common sense. And also like on the commode, when you're, around your commode, I want you to use a raised toilet seat. All these things are available to you to help you function easily, to conserve energy, and to stay safe. So the raised toilet seat is nice. If you have grab bars where you can pull yourself up, we put new ones, recently, because many of my members were saying to me, gee, it's hard to get up, so we have them all put into it. Invest in this to keep you safe. What do I think about throw rugs? Forbidden. I forbid you to have a throw rug anywhere in the house if you're a senior, particularly if you're a senior with Parkinson's disease. You are asking to stumble.
Even if it has the rubber?
Yeah.
Even if it has the rubber,
No throw rugs, yeah.
no throw rugs. I gotta tell you something. I have inside my French doors from my deck a mat. I don't know why, and it's on rubber, but it's on the carpet. And I trip on it all the time. I just took it off. You see what I'm saying? So let the carpet get dirty. What do I care? You see what I'm saying? So just don't risk it, even in your kitchen. Because if one little thing comes up, you're going to go down. All right? No throw rubbers. Yeah.
We put a lawn chair in the shower.
Sure.
Instead of,
That works.
yeah. And then you don't have that cold plastic feeling anyhow, because it's got
That's
a
great.
lawn chair cushion. And it has handles.
One of those plastic ones?
Well, no, it's actually a real full-fledged lawn chair with a plastic
That's
cushion.
terrific.
And
You know-
it's metal, so it's actually sturdier than the shower chairs because they were wiggling all
Be
over.
innovative. Be
And
innovative,
it works
okay?
really well.
Yeah, that's a great idea. Just sit on something, don't bend over, don't shut your eyes, hang on. If you drop the soap, leave it there. What about night lights?
Definitely everywhere.
Everywhere. A lot of the neurologists that talk about sleep disorders, they say it's not good, it throws your cycle off. If you see the light, if you get up and you see the light. I'm not talking about what I got going on in here. I'm talking a 4-watt bulb and a night light in key places in your home that when you get up, you can have a sense of orientation of where you are. It is critical. Okay? I have those little things all over my house. All right? So if you haven't done that, I want you to invest in. You know what ones are real nice? The ones that go on automatically when it gets dark. I use them. All right? The other thing too is be very careful if you're getting out of your car at night. If you're going to go out, daylight saving is coming March 9th. Did you all know it? Isn't that great? So now I can book things after 6 o'clock at night here for you because you might come for dinner with me, right? But even if you come home at night, make sure the lamppost is on. Make sure the front thing is on, all right? I have the sensors that deer have, and you go up the driveway and it's like somebody's trying to get out of prison or something because all the floods are going on, all right? So this is common sense. What about your shoes? Wear them, says Peter. What do I want to see in your shoes?
No laces.
Oh, you're slowing down.
Rubber soles?
Yeah, you want to wear safe, sturdy shoes.
Supportive.
Not flip-flops, not scuffy, what do you call them? Slippers, all right? Nice tie shoes, nice Velcro shoes, all right? So that you're sturdy and you're not gonna fall. You got me? What else can we do to stay safe?
If you fall in the bathroom, head towards the towels.
Head towards the towels. What, do we keep a stack of towels in here? I'm going to talk to you about just a minute is if for my caregivers, what are you to do if you see your loved one going down? Yeah, you have to let them go down. I mean, I hate to say that, it sounds so cruel, all right? But when someone falls, they're dead weight. They have lost the ability to stop the fall. And the problem with Parkinson's disease, Parkinson patients, is when they start to fall, they can't stop it, particularly if they're in a freeze. You know what the freeze is? I had a gentleman here asking me about freeze. Where are you? The gentleman that came to me and talked about freezing. He went home. Oh, hi. Okay. Freezing, what happens when you freeze? How many of you are frozen? It's a dreadful word, like the abominable snowman, you know. You freeze, you stop. All right? And this is one of the dilemmas with Parkinson's disease. Your brain is saying walk, 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 and your body won't do it. All right? This is your highest risk of fall when you're frozen, because you can't get out of it. All right? So when you're frozen, you're at a very high risk. Pay attention and do not rush yourself out of the freeze. And you loved ones, don't say, hurry up, honey. Come on, let's go. You can cue them and promote them and encourage them to get out of that freeze from now until next Tuesday, and it ain't going to do any good. Have you learned that, my friends? Your loved one is going to get out of that freeze when he or she is ready to do it and when they're able to do it. Now, how do you get out of the freeze? Huh?
Relax.
You need to do a distraction because the brain is frozen as well as your body. You know, we walk without thinking about it. I see that walkway, I'll walk right over it. The patient will not. Freezes usually occur when you're going off a curb, when you're going over a threshold in the doorway, when you're going from the carpet to the tile floor. Your brain gets all confused. And you stop. And I mean you stop. Right? You stop. All right, so how do you get out of it?
Stand still for a couple of minutes.
You just stand still for just a minute, says Thelma, and then you want to trick your brain. You want to do something totally opposite than what your brain is thinking you're forcing it to do. Huh? Count to three. Excuse me. Counting works. 1, 2, 3, 4. Marching works. All right? Your body's, you're trying to drive yourself forward. So take a little step to the side, take a little step to the back, slowly holding on to something. All right? Sometimes to make the turn or to move, you got to do the foxtrot. Remember that? What is it? The box step. I was close.
Well,
My mother made me take those classes. She tried so hard to make me into a lady. You know what I mean? With the white gloves and everything. And 5th grade learning.
Okay.
It didn't work, said Thelma. Thank you, darling. I can do the box.
Marilyn, there's still hope. White gloves are coming back.
Yeah, white glove. I have them under my bed from all my deceased aunts and everything. They're there somewhere. All right, but you want to just take your time. The laser pointers are very nice. And you know, I might encourage you. You know the laser flashlights, they really work, friends. And the laser canes are very, very, very expensive. Outrageous. And you can do exactly the same thing with the little laser flashlight. You know the little red light? Like if I was doing a PowerPoint and I wanted to show you where I was talking about and I would shine a light up there would be a little red light. Okay. You can buy them anywhere. And just keep them in your pocket. But if you go into a freeze and you put that laser light out there, for some reason your body will go for it.
Wow.
Okay? Some people sing, some people count, some people march,
Just pretend you're kicking a soccer ball.
whatever. You'll find what works for you. all right? But you want to trick your brain, you want to do something to distract your brain away from that whatever command to walk forward, okay? But be real careful. If you freeze, just stop like Thelma said, take your time. Don't get impatient, my caregivers, and try one of these little tips and tools to get yourself out of it. All right? How many of you freeze a lot? Yeah. Some Parkinson's patients never freeze once. You know, please understand I'm talking about almost all of you in the course of your life will fall. All right? A lot of seniors fall, right? I just want you to be real careful for this. Please remember, if you've never fallen before and all of a sudden you fall, that's a little red flag going on, isn't it? That's a little red flag going on. Something's going on. Am I getting weaker? Is my balance getting weaker? This might be a time to add additional services like physical therapy, like the big program, all right? And then if you're only used to falling once a month and all of a sudden you're saying, Mara, I'm falling once a week, and you say, Mara, I'm falling every day, that's a real red flag for me. So we have to have a real look at you, make sure your meds are right, make sure we have you exercising, make sure you have physical therapy, right? All right, because please don't fall, all right? What other things can you do to keep yourself safe and mobile? Be focused. Yeah, stay focused. Pay attention to what you're doing. This is one time, my Parkinson patients, really pay attention to what you're doing. Really pay attention to your safety. There's one thing I admired about my late mother. You know, she said to me, Mara, I know I can't fall. And when she would mobilize from her apartment to the dining room, she was full focus on being in that walker, okay, and taking her time. And if she wanted to chit-chat, she stopped, okay? But she paid attention to getting from point A to point B safely. And she never fell, okay? So really pay attention to what you're doing. Stay focused. That's a good point. Go, Lisa. Okay?
Yeah. How about, all of this is very important. About every week you're putting out another bulletin on the wall. How about putting all this on a piece of paper and passing it out to everybody?
Did you just give me another assignment, Erwin? Erwin,
What?
you just gave me another assignment. It's right. I really tips and tools like this, because I know you can go all over the internet and find all this kind of stuff. But I really have a way to simplify everything, you know, keep it simple, sweetie, okay? And really, I'm going to have that assignment for you too. You can help me with that.
I just fell out the other day.
I know, we saw you do it. Erwin, yeah, well, actually, Lenny came to me and said Erwin just fell. When you think you're out of the building, we're watching through the windows, okay? So Lenny said, oh, Erwin just fell. So we're going to get you some more exercise or something like that. This is common sense, friends. All right, keep yourself strong, keep yourself safe, pay attention, all right? Be very careful that you don't have, you know, shoes, slippers, anything in your walkway, all right? If you're gonna take your shoes off at night, put them up, put them where they belong, all right? So when you get out of the bed, remember, please, when you go from sitting or lying down, what do I want you to do? What happens when you're laying down and all of a sudden you have to go to the bathroom in the night? You get up very, very, very slowly. You go from here to sitting, right? And then you dangle, like this. You dangle. What are we doing when we dangle? You dangle your feet underneath the side of the bed. What are you doing when you dangle? You should know this answer. Come on. You're readjusting your blood pressure. All right? When you're laying down and you sit up, your blood pressure drops. When your blood pressure drops, you pass out. So I don't want you in the nighttime saying, this is why I don't want you waiting till the last minute if you have to use the bathroom. You know, if you're anything like me, it's 3 o'clock in the morning, and I'll please go away. You know, just let me sleep. You know, and I'll talk myself out of it, and it never happens. Don't do that. If you have the first urge to go to the bathroom, you get up at that point. You take your time. You dangle so that your pressure has time to stabilize, and then you stand up. You wait another few. Count to 10 for me, and then you have your walker or whatever. You follow the light to the restroom. Common sense, all right? Because the outcomes for falls is not good. All right? Any other ideas? Okay, did this help you? How many of you have really safety-proofed your house? Yeah, I want you to go home today and really take a look at it. Really take a look at it. That you have lights where you need lights, you know, and where you have throw works nowhere. And if you don't have grab bars, I recommend that Mr. Grab Bar. He's a very nice man. He's very affordable. Yeah.
What about area rugs? Do you feel the same way as
I think anything that can flip up. A rug on a rug
or on tile?
or on tile. Anything you can trip on. It's not worth it. And some of them are gorgeous. I know that. They are gorgeous. But just say, could it hurt me? Could it hurt me? All right? Because if you fall, you're going off the grid. All right? You're going to have time to recover. All right?